Greetings. My name is Cheryl Wissa, and I'm the National Diabetes Initiative Chair for the Student National Pharmaceutical Association, also known as SNAPA, and I would like to welcome you to Part 1 of the Life is Sweet, Savor It, Patient-Centered Mini Lecture Series. This mini lecture will cover medication assistance. A few words about SNAFA. SNAFA is an educational service organization of pharmacy students whose purpose is to plan, organize, coordinate, and execute programs geared toward the improvement of the health, educational, and social environment of the community. We are dedicated to the pharmacy profession and serving the underserved. Now a few words about our guest speaker. Dr. Rebecca Grandy is a clinical pharmacist at the Mayheck Family Health Center in Asheville, North Carolina, and she is also an assistant professor of clinical education for the UNC Eshelman School of Pharmacy in Chapel Hill, North Carolina. She is board certified in ambulatory care pharmacy, and her practice includes chronic disease management. Dr. Grandy's research interests include the role of pharmacists in primary care, rural health, and underserved populations. Without further ado, Dr. Rebecca Grandy.
Thank you and welcome. We're going to be discussing the flavors of medication assistance. This is a topic that's near and dear to my heart because at one point or another, everyone has trouble affording medications. So what I want to talk about are the different options that are available to you as patients, regardless of whether you have insurance or whether you don't. And at the end, we'll go back and talk about the different options based on insurance type as well. So the 4 flavors that we're going to talk about today are listed here, but we're going to talk about local discount medications that are available at your local pharmacies. We'll talk about coupons and discount cards, mail order pharmacies, and also patient assistance programs. So our first flavor, our local discount medication list. This is actually one of my favorite types of medication assistance because they're easy to use and anyone can use them. They're offered at most chain pharmacies and several local pharmacies, and the best way to find them is to ask your pharmacist. So if you currently go to CVS or Ingles or Walmart or Sam's or any other pharmacy, just go to your local pharmacist and ask if they have a discount list. You can also find them online as well. The trick with the discount medication list is that most of them do have different requirements for enrollment. Some of them require that you sign up and there's a yearly fee, and that's based on whether you want to sign up as a family or an individual. And then other ones don't require any enrollment at all. They do have specific requirements for prescriptions. And so some prescriptions they may want you to have written as 90-day prescriptions, and other places are fine with 30-day fills, and so you really need to ask your pharmacist what they prefer. The thing you have to remember about these, though, is that they do not use your prescription insurance. So you actually want to ask your pharmacist not to use your insurance. And that's a little different than what we're used to thinking of. So the medications that are available on most of these discount lists are a little more limited, and they typically include our older generics. So medications like glyburide, glipizide, glimepiride are our sulfonylureas. They also generally include metformin. And so I've given you an example here. At most of these pharmacies, you can get 90 days worth of your medications for $4, or you can get 90 days for $10. So you can save a little bit if you're willing to pay for a 90-day supply. And then another fact is that some pharmacies actually have free medication lists. I know Sam's Pharmacy has a free medication list, and so does Publix, which is a grocery store here in the Southeast. So it's always worth asking. The next type of medication assistance are coupons and cards. These are a little harder to use than discount medication list, and so, but overall, anyone can use them, though. But the first type of coupons that we're going to talk about are drug manufacturer coupons. These are a special type of coupon, and you can only use them if you have private insurance. So if you have Medicare, Medicaid, if you're uninsured, or if you have VA or veterans insurance, you're not eligible to use them. These medications, the nice part is that they're often free for a year, or you get them at a reduced copay. And so the way these work is you take these coupons to the pharmacy, and your pharmacist will use them in addition to your insurance. And then, like I said, you'll get these medications free or at a limited copay for a period of time, which can be as short as 6 months, and I've seen some as long as 2 years. The nice part about these is that a lot of our expensive medications, like our insulins and injectables and newer oral medicines, are the ones that are available. And it's really brand name only medications that you can get this way. So I've listed a few examples here, but there are lots more medications that you can get through manufacturer coupons. But Invokana, Lantus, Levemir, Victoza, Byetta, Humalog, Novolog. Like I said, this is really where you're going to get the biggest bang for your buck as far as the injectables. And a lot of doctors' offices will have these coupons available, or you can find them online. So for instance, if your doctor just prescribed you Lantus, which is a pretty common type of insulin, you can go on the internet and search for a Lantus copay card or prescription card, and that will pop up for you in your search. So there are other coupons and cards that anyone can use, and the medications are discounted based on your location and based on the pharmacy, and they vary greatly in price. These do not use your prescription insurance, unlike the drug manufacturer coupons that we just talked about. So where do you find these? So there are lots of places to find other coupons and cards, but two of the most common are called goodrx.com and scriptsave.com. And scriptsave.com, I know CVS just went to this for their discount medication list. They used to have a discount medication list available, and they've done away with that, and instead they use ScriptSave. If you do want to look at this website, it requires a group number, and that group number is 1264, and that's true for regardless of who you are, what insurance you have, or what part of the country you're in. And the nice thing is that all medications are available with these coupons and cards. So let me show you a little bit how that works. So here at the top, you can see I've gone to goodrx.com. In the search bar, I've searched for pioglitazone, which is the generic name of Actos, which is a common diabetes drug. Most of these websites, if you want to see the price for a medication, you have to make sure that you're telling it if you want tablets or capsules. You want to tell it the milligram strength. So here you can see I've selected 30 milligrams and I've selected 30 tablets. So after you have that filled out and you've given it your location, it will actually show you the price of the medications with their coupon. And so GoodRx, you can print out a coupon for a single medication, or you can print out a discount card where you can just take to your pharmacy and use as insurance. So here you can see at Sam's, if you're a member, you can get free Actos, or at Kmart, you can get it for $10. And so it organizes it by price as well. Here's just another example. I went to ScriptSave, and again, I'm in North Carolina, and so it found my location and found the closest pharmacies to me. I selected the same thing, so pioglitazone. I did 30 milligrams for 30 tablets, and the cheapest I got was actually one of our local pharmacies at $26, and at Kmart you can see it's $197. So with these coupon cards, it's nice that you can go online and sort of shop around and find the cheapest prices. You know, with that being said, it's best if you can stay with one pharmacy. Because just like having one doctor, if you have one pharmacy, they're going to be able to make sure you're not having any interactions with your medicines, and it's really safer to stay with one. But you can do a little bit of shopping around just to see what the best prices are overall. The other type of medication assistance is there are discount mail order pharmacies out there, and I think people know less about these. The biggest one, and the one I know most about and recommend people to try, is called rxoutreach.org. It works just like any other mail order pharmacy. Anyone can use them as long as you have a lower income. And so they will ask you some eligibility criteria based on your income, which I'll show you. They want you to be less than 300% of the federal poverty level, and that's what FPL stands for. So everyone is a certain percentage of the federal poverty level. The higher your percentage, the more money you make. So let me show you how that works. So for this particular mail order pharmacy, you can see here on this chart, if there's one person in your household, you're eligible for this program as long as you don't make more than $35,640 a year. And for each person in your household, they're adding $12,420. And all of this information is available on their website. There's a tab called Find Out If You're Eligible. But basically, if you have a lower income and you meet these the criteria here based on the number in your household, you will be eligible. So this particular mail order pharmacy offers a discount on most medications. It does not use your prescription insurance, and your doctor can send prescriptions to this mail order pharmacy just like he or she would to any other pharmacy. They can use a fax or they can e-scribe, and they do like it to be sent as 90-day with 3 refills. So here, I just copied and pasted the list of diabetes medications that are available. And so if you look in the left column, you can see the generic name of the medication. The next column has the brand name, if you're more familiar with that. And sometimes they'll have 2 brand names. The next column has all the milligram strengths that they offer. And then the last 2 columns are the price for the medications for a 90-day supply. And then the very last column is actually the price of the medications for a 180-day supply. So they'll send you a 180-day supply of the medications if you have the money to be able to give them. So for instance, the first one, we looked at pioglitazone or Actos earlier. You can get every strength available, and you can get a 90-day supply for $25. And we'll skip a few down. Metformin is really common. Metformin ER, you can get the 500s or the 750s for $20 for 180 days. So you can get 6 months worth of medications for $20. This particular mail order pharmacy, though, you do have to sign up. So you have to fill out an application, and you can fax that in, you can do it online, you can do it through traditional mail, and then you would tell your doctor that you're using this mail order pharmacy, and they would start sending your prescriptions there. So as you can see from this list, though, most of the medications that are available to treat diabetes are oral medications that are a little older. The last type of patient assistance we're going to talk about are actually patient assistance programs. So the people who are eligible for these are if you have no insurance or you have Medicare. And these medications are actually provided free from the drug company, and they'll send them either to your home or to the doctor's office, and you don't have to use your prescription insurance. The trouble with these, though, is that there is a lot of paperwork required. You have to fill out an application. You have to give them income documentation. So you have to give them your tax returns, your Social Security letter, if you have pensions. And the turnaround time after the application is normally 4 to 6 weeks. So it's not a quick way to get your medicines, but they are free and they come from the drug companies. The best place to find out if there is a medication assistance program available for these is needymeds.org, and I'll show you a little bit more about that on the next slide. But this website really gets a gold star from me because it has so much information on there about affordable medications and other resources that are available to you. The patient assistance programs are pretty much brand name only medications. And so this is another place where if you're having trouble affording your insulin or injectables and you meet the criteria, it will be good for you to look into. So on needymeds.org, you can search by the drug name for patient assistance programs. They also have their own drug discount card. They have a place where you can search for discount drug lists. So the first type of medication assistance we talked about was discount drug lists from your local pharmacy. Well, on this website, you can actually go type in your location and see what lists are available. And then medication assistance programs are programs that will help you complete the paperwork for these patient assistance programs. And you can find local ones when you type in your address or your state on this website as well. So this is what the website looks like. And the tab that you're going to want to go to is where the actual purple arrow is pointing. This is patient savings. And that's really a link to all those resources that I just spoke about. So, and I also wanted to introduce a special flavor, because if you have Medicare and you have a lower income and you're having trouble affording your medications, you really should apply for something called Extra Help. The other name that people use for this is Low Income Subsidy, or LIS, and it significantly reduces your copay on medicines. Most medications, once you have this, aren't going to be more than $6. And then in addition to helping with your medication, it also helps pay your Part B premium. So if you're a member, your Medicare Part B is what pays for your office visits, so it can cut down on those costs as well. If you're savvy with the internet and you feel confident that you can apply for this on your own, you can go to www.socialsecurity.gov/extra-help and actually find the application online. Or you can call Social Security at the number listed, and they will help you do the application. That normally takes a little more time. Social Security is not the speediest office, but you can call and someone will help you with that. So if you have Medicare and you're having trouble affording your medicines, I strongly encourage you to apply for Extra Help. And then even if you're not eligible, most of those patient assistance programs from the drug company are going to want you to be denied for this Extra Help before they'll send you free medications anyway. So remember, this is just kind of a summary. So for everyone, always go talk to your local pharmacist. He or she will probably be able to give you some really good advice about what discount medication lists they may have at that pharmacy, or they may be able to print out some of these coupons that we talked about for you. Everyone is also eligible for discount cards and the discount mail order pharmacy, assuming you meet that income criteria. And other specifics to insurance, if you have private insurance, you can also do those drug manufacturer coupons. With Medicare, again, I would strongly encourage you to apply for Extra Help. You may also be available or eligible for several patient assistance programs. And if you have no insurance, you'll be eligible for patient assistance programs as well. And then just some credits for all the lovely cupcakes that we've had. And this was sponsored by Walmart and Sam's Club and Snappa, so thank you to the three of those.
All right. Thank you, Dr. Grandy, for taking the time to discuss ways in which patients can gain better access to not only their diabetes medications, but to other medications as well. And as the slide does say, we just want to give a very special thank you to Walmart and Sam's Club and Snappa, by whom this lecture was sponsored. And then thank you to all the listeners of this web lecture. We do hope that this has been informative and will be helpful in your everyday life and in managing your diabetes. So this concludes part 1 of the series.